In this video, we're going to cover piriformis syndrome, which is located right there. Whether you feel aching, stabbing, shooting pain into that area or a little bit around it, this is going to be a good video for you to put into your library. We're going to cover the 9 best stretches for piriformis syndrome today, so stay tuned. Hey everyone, I'm Sebastian at Performance Play Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. Before we go on to the whole video, I want to give you a line item list timestamps of basically where you're going to experience different things in this video, because it's going to be a little bit of a length of time. You can skim forward if you'd like to, but I encourage you to stay around for the entire video if you can. Number 1 is we're going to cover how and when to use these stretches. Number 2 is safety, should you be using them at all. Number 3 is going to be which tissues we're actually stretching during which. Number 4 is going to be the actual stretches, 9 of them, all in sequence. You can follow along just along with me with it. And number 5 is we're going to go through root cause, what piriformis syndrome is, as well as the biomechanics associated to it for those of you who care about that type of thing. Knowing how and when to use stretches is super important. The first thing that we like to stress is the dosage. Typically, people do them throughout the day for about a week. In that scenario, you can think of them almost like a medicine cabinet. You're taking a medication in and out of a medicine cabinet. When you need it, do it for about a week. When you don't need it, put it back on the shelf. The point of this is to make it so your body doesn't become immune to the medication itself. And stretches and exercises can be just as useful as some forms of medication if you use them right. Now on to safety. Stretching should feel stretchy. Let's take a logical approach at it. It shouldn't increase your symptom. You may feel stretching through the tissue that needs to be stretched, but it should feel stretchy, okay? If you don't know what a good stretch feels like, it's easiest just to use your finger or your wrist as a reference. If you cock it back quite a bit, you'll start to feel that it feels a little stretchy on the opposite side of which you're moving it. And this is normal, and after you're done, it dissipates. That's a completely normal response. It shouldn't have increased symptoms or increased feelings of stretchiness later after you're done. Now, if you had a hip replacement, this is not going to be the series of stretches for you. You need to actually follow a more customized type of stretching program to make sure you don't compromise your hip. The last thing we got to understand before we get into the actual stretches is what tissues we're stretching. What's the intention of the stretch anyways, or else they seem kind of pointless and people just don't do them. So we have a little model here to reference just a few aspects, so there's not one actually on here. One of them is going to be skin stretching. So skin stretching is pretty basic. It's not on the model here, but it's just on your skin. It's like you're pulling on your skin and stretching it. We've covered it in a lot of different videos that we've covered, but there's a few ways to stretch the skin. There's tractioning the skin, and then there's holding the skin going through movement, and I'll show you that when we get to the stretches. The other thing is we can stretch the actual soft tissues or muscles in the area. This is the hip flexor in this model. You can stretch the actual muscle itself, or you can try to stretch out a trigger point within the muscle. The last thing you can do is stretch the joint. Stretching the joint in this one is going to be the actual hip, okay? So the things that stretch the hip joint versus the muscles or trigger points and the skin, the technique is actually different and the reps and holds matter quite a bit. Obviously, this video is all about our stretches, but we have another video to come. It might pop up in the corner, which is about the exercises we like to use with piriformis syndrome, which help out with core stiffness, hip strength, and entire strength of the leg on the side of involvement. Now, as we get on to the stretches here, we're gonna do a little counting of time in the corner, and I want you to just follow along with me. Ideally, if you do this efficiently, it's only going to take about 9 minutes to do, especially if you're only doing one side. Obviously, if this creates any problems with you, you should not be doing it, and there's a reason why people have jobs where they coach people and customize programs for something like this. So if you have any problems, please reach out to us and let us guide you through a more customized program for you. But this is a good starting point for most people. Now, the first one we're going to do is static stretching of the skin around the hip. And I'm going to start my timer here just so we can get a little bit of a flow through it. And you're going to grab the skin right around the top part here, right around the crest of the hip, and you're going to start yanking on it, all right? You might find an area that's pretty sensitive, and that's okay if you don't. Keep walking your hands around the skin to find areas that are sensitive. You may notice that I'm starting up at the crest here again, but you can certainly work your way down into the muscle of the hip down here, but remember, stay on the skin and even work out into here too. All of these areas provide a really good value if you find an area that has some stiffness or it's really hard to pull off the muscle. or off of the layer below it. So we got about 20 seconds left. We're gonna spend a little bit of time tractioning the skin at the hip before we move on to a traction and movement based one, or a dynamic skin stretch. Okay, even these areas up in front here are really nice to do. Now the second one is gonna be a dynamic skin stretch, meaning there's movement associated to it. The last one, we explored the area and we figured out what are the most sensitive spots. Now we can use that information, hold the area of sensitivity, and move the hip or the pelvis through range. And so for me, it was the most sensitive right at the top of the crest, kind of where the SI joint was. That's a good spot to start for me. So I'm gonna grab it for both hands, start the timer for you, and we're gonna start making some pelvis hula hoops, like you're just trying to move a hula hoop really far around your body. Usually I go for about 10 reps or so. There's no magic to the number. And then actually creeping my hands to different locations that we're sensitive to and continuing with the hula hoops. Okay, so the hula hoop's just one motion. The other one is going to be, and you're on the floor, you can move your foot like it's going over a puddle of water, still holding the skin. For some people, this is super sensitive, by the way, so most of the time that sensitivity goes away once they're done holding it, you know, but that can be around for a while. And then lastly, we're gonna move the knee up, so hip external rotation, and then foot up, which is hip internal rotation. All of these may have a unique change on how you feel things, so it may not be perfect for everybody, but I find that one that works really well for me is the hula hoops. Now the next one we're gonna do is targeted mainly at the muscle, and this is gonna be mainly the piriformis muscle here. And so we're no longer addressing the skin, we're addressing muscle tissue. And so what I like to do is the seated version, and we're gonna start the timer, cross the leg over with the symptomatic side, pull up slightly on the knee, and see if you can bring your shoulder towards your knee, okay? This produces a really nice stretch on the backside here, okay? For me, it doesn't increase my symptoms. It just makes me feel like I'm untensioning on the tissue. And once you feel like you got everything kind of settled down there, you can hold this for about 10 seconds or so. Remember I said that the muscles and the joints in the skin responds differently to different types of holds. I'd say about 10 seconds or so, not super long, just about a 5 out of 10 stretching feeling before returning. You can obviously do this on both sides, but if you're only dealing with one-sided complaints, time productivity, I would just do one side. Okay. If you feel really ambitious, you can pull it towards your opposite shoulder and see how that fares for you. Now the next stretch we're going to cover is mainly for the hip flexor here. It goes from the spine and goes all the way down into your femur here. We've already done the piriformis. We also have to do the quad a little later. We won't need this chair for the next two. So this one, people are generally familiar with the setup, but let me just fine tune a couple things before we start the timer. All right, so we are going to creep the foot out to pre-tension the hip. You see how this is creating a nice line back like this for me? Okay, what I don't want is this type of deal, and you see how hard my front knee has to work before you even get a significant stretch out of the hip. And so we're gonna start this timer here and start going at it a little bit, okay? So I pre-tension the hip a little bit here and actually put my elbow onto the knee and elbow onto the elbow. And so now I can just rock in and out just a little bit like so. Just like the piriformis stretch, I want to explore range just a little bit first before we start going at it and spending 10 seconds into the stretch, because as I mentioned before, the muscle's like a little bit of a longer stretch than the joints. The joints respond a little bit better to pumping, okay? And so we're gonna hang out here for about 10 seconds or so and just breathe into it. Breathe into it. That was about 10 seconds. 3, 2, 1, back in again. Okay, you can obviously do both sides, but I would spend the more time on the problematic side. You may notice at the end of the breath, you can sit into the stretch a little bit better, okay? So that addresses the hip flexor. Now we got to do something like the quad. I'm gonna show you with this chair here, but to be honest, I don't really like this couch stretch that people use. There is a nice bias towards it, towards the quad when you put the foot up, but this angle's a little bit too aggressive for most people, including myself. You're gonna have to put something underneath the knee or else it's just gonna get it completely beat up. But imagine you have something a little bit lower, like a box, like this box, which is a yoga block, okay? The yoga block can be positioned in a few locations to make the height appropriate to you. So what I would suggest doing is you rest your foot on here, or the crook of your foot, and then you find the position that we talked about, and I'll start the timer. So I'll see if I can even tolerate it this long, just because my knee's gonna get beat up just by setting up into the position. But as you can see, there's a little bit more of a knee bend associated to it before you do the walkout. The same rules apply. You're going to pre-tension the muscle you're trying to bias first. In this case, it's the rectus femoris, which does end up using a little bit more of knee bend. But for some people, they can't tolerate that much knee bend, which excludes the value of the couch stretch. If your range changes, by all means, add the couch stretch. But this is a good starting point for most people. Now, I want you to notice that I'm doing a little bit of a flare here. Like, you can almost probably see my zipper. I need to make it so my zipper turns away from you to get any significant value out of this. Same rules apply. We're gonna hold it for about 10 seconds and breathe into it. Okay, so I can't stress this enough with this one. If this one increases your symptoms, you may be going too far. Some people, when they set up for it, and I'll just give a basic example of with this chair, is this chair, if it's too high and you lean back, actually their spine starts to extend and they go into an anterior pelvic tilt, which doesn't really help out with the mechanics associated to most piriformis syndromes. Now we still need to do the hamstring. So let's get this guy out of the way, get this guy out of the way, and then we're just gonna lay on our backs like so, okay? This one's pretty simple. We'll start the timer and go, but I'm gonna do this leg, just act like this is the symptomatic leg. I wanna make sure I cock my knee up first before I start to extend my shin. But you can go just like so. Again, exploratory. Try about 10 reps as you're exploring range. After that, you can go to the point where you feel, okay, I feel quite a bit of tension through here, most common, and then you breathe into it. And then bring it down and go again. So this one should not really recreate your symptoms here. If it does recreate your symptom, I would actually decrease the amount of knee height first and try it at a longer position, or go more for reps because your muscles may not be really ready for that amount of pull. Some people feel sit bone pain with this, some piriformis, some low back stuff. So let's not blow through that. Be a little bit more mindful of what you're doing or the ways to modify it when you're doing so. You can also cock the foot up as you go versus the shin up first and then the foot back to bias it if you do have those problems too. Now the last muscle stretch I want to do is back on the piriformis again. This one's going to be more of a hip focused version to it. Okay, a lot of you have probably seen this before, but it's important to figure out which slot your hip will take. And so this is the symptomatic side here. And so we've already started the timer. And ideally you try to bring your knee across to your opposite shoulder here. But here's the thing, a lot of people feel pinching in the front of the hip here. Now, ideally that's not what we want. So we're gonna explore range here. I'm gonna bring my knee up to my chest first. Okay, that's okay. And then up a little bit more across your body, oh, that's okay. And then go across, and that's not good. You're gonna find the last range that it was tolerant of, and then you're going to pump into the range, exploratory, just as we mentioned before. And then you're gonna find a position that's tolerating of, and you'll feel a little bit of a stretch here, and then breathe into it. You should notice that your breath actually moves into your thigh, which for some people decreases the pinching feeling they have in the front, okay? So we're gonna do the same thing to both sides if you wanna do both sides. Then now we're gonna get into more of a joint approach. And again, the joint approach requires a little bit more pumping effect, all right? It shouldn't increase stiffness or pain as you start to go forward. It should dissipate over the course of a minute or so. The first one we're gonna do is part of the hip capsule stretch, which is in the same position, except for now we're gonna go the opposite direction, all right? So we're gonna take this guy and we're gonna actually push him away from us and return. Push him away from us and return, okay? I'm gonna go through a bunch of exploratory reps here and just breathe into the floor again. Don't worry about how your breathing happens, just think of it the direction. You're gonna go breathing towards the floor, like down into here, shot, okay? And we're gonna go through reps of range. We're gonna see how far you can get your knee away from your shoulder. Again, I mentioned earlier, total knee replacements, this is not gonna be something you wanna do, which is why customization of your exercises, your stretchers are gonna be important. But for most other people, this is okay to do, okay? Usually about 20 reps or so is what you fit in about a minute. Full range. This short range doesn't matter. It's not gonna help because you need to take the joint and the tissue to end range before you actually start loading into it, okay? Now the last one we wanna do is part of a spine joint mobilization or stretch. And this one's gonna be called wag the dog. Wag the dog is a really nice, easy one to do, which doesn't bother a lot of people. A lot of people are familiar with the cat and the cow and so on. This one's kind of like the other way. It's kind of like so. So if you had a tail here, the tail's gonna start moving the dog, okay? And so I'll start my timer here and we'll just go through it. There we go, okay? So it's almost like you're trying to create bends or openings in your spine here, okay? Bringing my right shoulder to my right hip really gently, left shoulder to left hip really gently, and so on. If you feel ambitious, you can actually go through the other range like the cat-cow. But this one's a really nice one just to explore lateral motion range. For a lot of people with piriformis syndrome, as we talk about in the upcoming section, we notice that there's a lot of frontal plane issues, which is this is the plane we're working in right now. And if we start to open the spine and let the pelvis and hips go through frontal plane movement, for a lot of times their symptoms dissipate really quickly. Okay? For other people, not quite. Now you notice I'm in a little bit more of a sloppy position with my spine. I don't really care which position you're in, and you can explore both of them if you want. But a lot of people, when they're in this extended position here, they actually won't move a lot. They'll actually have better movement through the frontal plane as they start to let their spine just slacken a little bit. Those are my favorite 9 stretches for piriformis syndrome, and we addressed all the tissues, but it's important to realize that stretching is only part of it. It does help out with pain. A lot of times you put that in your medicine cabinet and pull it out and use it when you need to, but really to control flare-ups, you don't have to keep reaching into your medicine cabinet is super important. And that's where corrective exercise, repatterning exercise to help out with movement compensations really does play in here and actually building strength. I know some of you who may have been watching this, you're like, oh, I can't get on the floor. That in itself is a big win, that if you can get yourself on and off the floor, it can help out the strengthened parts of the limb, which will help mitigate any flare-ups too. But now that we covered the stretches, let's go over the reasons why these things are actually important in the biomechanics and root cause section. Now let's get on to the classic symptoms of piriformis syndrome. And just to note, there's slight variations on all these, which we'll cover in a second. Now, piriformis syndrome is going to be mainly located right around here. It's going to be like a deep buttocks pain that most people call it, but sometimes it travels down into the back of the thigh here, sometimes into the calf, which may present as an aching, stabbing, shooting. There may be numbness or a change of skin sensation. Some people just call it like a tightness. This just tends to travel and move along the leg a little bit. It can jump spots too, and sometimes it goes to the bottom of the foot and creates a little bit of tingling there, or it can mimic things like plantar fasciitis or heel pain. This can also be misdiagnosed as a lumbar radiculopathy or a pinched nerve from the low back. Some non-classic presentations we found are going to be around the buttocks area, but also up to the SI joint. A lot of people will think they have SI joint sprains or strains. Some people feel it wrap around to the front a little bit, to the front of the thigh into the groin, and sometimes traveling down the thigh here, which will make people feel like they have hip impingement or an adductor strain. We've also met a lot of people who have it right here on the sacrum area, the top of the SI joint, and it also travels down the side of the thigh a little bit and becomes a little bit of achiness in the knee, which can simulate something like IT band syndrome. And we've also had people who have had it into here and it jumps to the heel, and they feel like they end up having piriformis syndrome plus heel pain, which is going to be plantar fasciitis. There's a lot of misdiagnosing that happens with this type of condition because it mimics a bunch of other ones too. Lumbar radiculopathy or pinched nerves, also lumbar disc herniations that we can refer down to the leg too, but they usually don't go past the knee. There's SI joint sprains. I've met a lot of people who thought they had a sacroiliitis, which is technically an inflammatory condition, which is ruled out more blood work. It's not always mechanical based. Hip impingement, if I didn't already say it, labral tears, IT band syndrome, or just generalized muscle soreness or trigger points. So there's a lot of different things that people think they could have, but realistically people typically have one symptom generator, which creates majority of the apex of their problem, in this case the piriformis, with a bunch of other compensatory symptoms. And what I mean by that is the primary diagnosis or the symptom generator creates movement compensation and excessive workload elsewhere. And so some of the other stuff you're experiencing that you may want to classify as a certain diagnosis is actually no more than just a movement compensation, and those muscles or areas become a little bit more overworked. Now, this is the problem overall, this self-diagnosing, multiple diagnoses, getting confused, which is super common when you're self-diagnosing on Dr. Google. And I met a lot of people who have been watching videos and so on and think they have multiple different things, and 2-3 years later, they're no further to the solution than when they started. And a good thorough physical exam helps you identify where to start. It helps identify the symptomatic tissue, whether it be the piriformis or something else. And it helps identify which areas are compensatory symptoms. So if you solve the main cause, you reduce all the other problems to it as well. And for a lot of people, their symptom reduction happens over the course of a month when they get the right type of care and right type of system in place. Now into the anatomy, we have a hip model here to help us out. This is our nice friend. This is the front of the hip. Here's the back of the hip. This is kind of, if you take me here, this is my orientation here. We got the thigh going down, the back part kind of meaty. It's kind of hard to tell because they've removed the glute max muscle. And so we have the glute max, which is over the top of this thing, and they peeled the thing off. And now we have the glute medius. We have the glute minimus. This is the glute medius tendon, as it attaches into the side of the hip, kind of the bony bone on the side right here that everybody has. And then we have the piriformis muscle right there, which the sciatic nerve travels underneath it or through the heads on some individuals, okay? But it's generally a really close proximity here before it travels down the leg, which is why some of those ambient symptoms down the leg or into the calf and should happen. The muscles down here this is the superior gemellus, this is the obturator internus, and this is the inferior gemellus. You can see the hip flexor in the front. This is the iliacus, this is the psoas. Together they're the iliopsoas, which go down in the front of your hip, which makes your hip flex like so. And then we have the hip joint capsule in the middle, okay? I want you to notice how small the piriformis actually is in relationship to even the glute medius, which is not really a big muscle either. The glute max is a big one. If you can look at the raw size of the hip flexor here, or if you took into account like the hamstring, it goes down your leg, which is most of the meat of the leg in the quad in the front. These muscles are actually very small in comparison, which is really important when you think about function. Now the function of these little muscles here, the piriformis included, is to seed the hip into its socket. So it's basically a ball and socket here. And so my fingers around it are not the right orientation, but just for effect, just humor me. And so as I form the cup over the femoral head here, actually these muscles take it and they seed it into the socket. And the same thing happens with the shoulder joint as well with the rotator cuff. All right, most of the movement doesn't happen by these muscles, but these create tension and happiness of the hip. Essentially, it makes it so its orientation is nice in the socket, and it's prepared for movement of the larger muscles. In this case, it's the glute max. Now, if you account for the size of these muscles and the pure function of what they do and what their abilities are, really they're not designed to move the hip a bunch, all right? Just like the rotator cuff of the shoulder, it takes the ball and socket of the hip, like here and here, which isn't really inherently weak in the hip. It's a little bit more floppy in the shoulder just by architectural design. But you take the ball and socket and it seeds it into the hip. And if you imagine my fingers here as the small muscles of the hip, they basically pull it in and make it so that its forces are equally seeded through, all right? And that's kind of its function. It prepares, these small muscles prepare the joint for good movement. And that movement doesn't happen by those muscles. It actually happens by the larger muscles that go around the hip, the big ones that you see that actually removed mainly off this model. The glute max is really important, all right? Even the glute muscles here, like the glute medius and the glute minimus, these ones are more preparation-based muscles. They're helping to support movement, but the movement doesn't happen mainly by them, all right? The hip flexor produces movement, the rectus femoris produces movement, which goes down the thigh, and also the hamstrings produce movement as you start to run as well. So those larger muscles do the movement, but you got to wonder, why did these small little guys start to become hyperactive? By the way, tight doesn't always mean weak. I think it's an important thing to know, because if you read a bunch of articles online, they'll say that the piriformis is tight and weak. That's not quite accurate. Tight doesn't always equal weak. Sometimes tight means overworked. And if you've read other articles where they talk about overuse injuries, maybe this muscle is being overused, there's some truth to that, all right? The piriformis is a really good helper. It tries to do the workload of other muscles, and maybe the glute medius and minimus is really not working well, and this muscle tries to work extra overtime to really help out to do these guys' jobs, or potentially the gemelli, the obturator, and so on. They're not doing their job, so we need to make sure the piriformis is not working so hard. And so I don't think we should call this as an overuse injury. We should call it an underuse injury. And this is where exercises and specific corrective exercises and repatterning ones, rehabilitation comes into play. You can stretch these muscles to death, or stretch the piriformis and all the other muscles to death, but it doesn't bring back the function and work capacity of the other ones that aren't working. Remember, this is an underuse injury, not an overuse injury. And if you get the other areas to work better, you get the other muscles to work better, you get the hip all happy and everything's working fine, this piriformis will stop taking so much workload. And for those of you who are having tension on the sciatic nerve that goes underneath or through it, this muscle will say, thank you. I don't want to work so hard. I've been working so hard for years. Why did you make me work so hard? In that case, your symptoms will reduce. So this, in a nutshell, is how we manage people with piriformis syndrome. We give them specific stretches to do. We help them find the tissues that are not working well, or the muscles that aren't working well, or perhaps the joint restriction which is in play, and the other areas around it which are being underused. And then we build a program appropriate for that. So if you guys are looking for help, you can reach out to us. We see people virtually and in person. We have a lot of online content as well off of YouTube on our channel. But we have a lot of different videos on YouTube. You subscribe to our channel and check those out too. Remember, we have a video on the exercises coming very soon. If it's not here already, it's going to pop up in the corner. I'll see you guys next time.